When we look at patient involvement in research, the main focus is, of course, because patients are the end user. So they're the ones taking the pill, they're taking that treatment, and they're the ones dealing with cancer overall. And despite how much knowledge that researchers and doctors may have, they don't exactly know how that feels. So some of the difficulties we face with trying to engage patients in research is really trying to figure out what is the best person to bring into this kind of equation. Patients have to understand research processes. They have to have some confidence to be able to get into a room with doctors and researchers and others and voice their opinion and voice it loudly sometimes. So really it's creating a culture of mutual respect so that when patients are engaged, they know that their opinion matters. I know for us as a Lymphoma Coalition, we do a lot more of this type of work where we're trying to see how we can pivot some of the research to better meet what patients are expecting or would like to see out of a new treatment coming to market. When we do that, because we get lots of opportunities now, we really do examine where we're going to have the best outcome, where we think that our opinion is valued, and where we're giving early opinions into a design. And the reason is oftentimes we get asked too late in the process, we can't change recruitment for you for a clinical trial that's in process if the clinical trial design was poor in the first place. But if you had engaged us early, then we could have pointed out what might be problematic for our patient participation. So instead, early as we can, if we get that involvement and really bring the patient perspective fully into the conversation, hopefully will lead to better treatments, hopefully also lead to more approvals. So regulatory bodies saying, yep, this is good, and payers agreeing to pay for these new therapies. And for everybody at the end of the day, that's a really positive result.